Welcome back to OMFS Essentials, concise knowledge for the modern maxillofacial surgeon. In this episode, we begin a new series on incisions, one of the most fundamental components of surgical access in oral and maxillofacial surgery. We'll discuss the principles of incision making, basic technique, and the importance of tension lines in achieving both functional and aesthetic success. Definition and purpose. The word incision is inseparable from surgery. An incision is made to drain abscesses, excise lesions, mobilize tissue, and gain access to deeper structures. Because human tissue responses to injury are fairly predictable, surgical principles have evolved to optimize healing and minimize scar formation. To place an effective incision, the surgeon must know the regional anatomy, vascular supply, tissue type, and healing characteristics. An ideal incision provides clear, tension-free access while avoiding vital structures, allowing for rapid healing and a hidden, aesthetically acceptable scar. The scalpel and its use. The word scalpel originates from the Latin scalpere, meaning to cut. A scalpel has two components, the handle and a detachable blade. In oral and maxillofacial surgery, the number 15 blade is most commonly used. The number 11 blade serves as a stab knife for abscess drainage, and the number 12 blade is ideal for procedures like operculectomy. The Bard-Parker system pairs a number 3 handle with a number 15 blade. The surgeon holds it in a pen grip, offering control and stability. Basic principles of incision making. 1. Use a sharp blade of appropriate size. A single, continuous stroke causes less trauma than repeated shortcuts. Multiple strokes crush cells, increase bleeding, and delay healing. Towards the end of the incision, the knife angle should shift from oblique to perpendicular so that the skin and deeper tissue end at the same level. 2. Incise layer by layer. A full-thickness, single stroke risks damaging deeper vital structures. Each layer should be exposed and incised under direct vision. 3. Maintain blade perpendicularity on epithelial surfaces. This ensures clean wound edges that approximate easily and resist necrosis. 4. Stretch the skin with the opposite hand to produce a smooth, precise cut. 5. Intraoral incisions should rest on healthy, attached gingiva supported by bone, never on inflamed or friable mucosa, to prevent wound breakdown. 6. Avoid crossing the papilla or marginal gingiva. Always cross the free gingival margin at the mesiobuccal or distobuccal line angle to prevent papillary recession or clefting. 7. Extraoral incisions should follow the resting skin tension lines, the natural lines of minimal tension. If these lines cannot be followed, hide the incision within natural folds, orifices, hairlines, or junctions between facial units. 8. Use as long an incision as necessary. Longer incisions provide better exposure and do not delay healing compared to short ones. Relaxed skin tension lines, or Langer's lines. The lines of minimal tension, also called relaxed skin tension lines or Langer's lines, reflect the skin's elastic adaptation to underlying muscle activity. Facial expression and repetitive motion produce natural creases that deepen with age. Incisions placed parallel to these lines heal with fine, nearly invisible scars. Conversely, incisions that cross these lines tend to gape, retract, and form unsightly scars. In the face and neck, these lines run transversely, especially along natural flexion creases. For the maxillofacial surgeon, Respecting these lines ensures aesthetic harmony and minimizes distortion of facial landmarks. Summary of key principles. Use sharp, appropriate blades. Avoid multiple cuts. Work layer by layer, maintaining control. Perpendicular cuts on epithelial surfaces aid closure. Follow resting skin tension lines wherever possible. Avoid vital structures and ensure tension-free closure. Place incisions in concealed areas or natural junctions when aesthetics matter. Successful incision making in oral and maxillofacial surgery requires precision, planning, and respect for tissue biology. A well-designed incision not only improves surgical access, but also determines the quality of healing and the appearance of the final scar. You've been listening to OMF's Essentials. Join us next time as we explore specific intraoral and extraoral incision designs used in oral and maxillofacial surgery. Until then, keep mastering the essentials.